Did quarantine effectively stop the medieval bubonic plague? Have you ever wondered how societies dealt with the terrifying spread of the bubonic plague during medieval times? One of the key strategies was quarantine. This practice aimed to isolate those who were sick or suspected of being infected to prevent further spread. The city of Ragusa, now known as Dubrovnik, was one of the first to implement this in 1377. They required ships and travelers to remain isolated for 30 days, which later extended to 40 days. This is where the term quarantine comes from, derived from the Italian word for 40 days. The 40-day period was significant because it was longer than the incubation period of the plague. This allowed time for infected fleas or individuals to show symptoms or die, which helped reduce the risk of spreading the disease. Cities like Milan took strict measures, even sealing infected households to contain the outbreak. They built pest houses outside the city walls to separate plague victims from the healthy population. This approach proved more effective than in cities like Venice or Genoa, where quarantine was not enforced as rigorously. However, quarantine was not always applied consistently. Many areas faced high mortality rates due to delays in implementing these measures or resistance from the public. The bubonic plague spread rapidly across Europe in the mid-14th century, resulting in millions of deaths. While quarantine did not completely stop the plague, it did slow the transmission in places where it was strictly enforced. In addition to quarantine, medieval authorities introduced health ordinances. These included controlling burial practices, restricting trade of potentially contaminated goods, and separating the sick in designated hospitals. These combined efforts showed an early understanding that the disease was contagious, even though the exact cause was unknown at that time. In summary, quarantine was an important public health response during the bubonic plague in medieval Europe. It helped reduce the spread of the disease in some cities, but it did not completely stop the pandemic. The effectiveness of quarantine depended on timely implementation, strict enforcement, and public compliance. This approach laid the groundwork for modern quarantine practices used in later epidemics.